we thought it appropriate to honor an individual in this community. And so we began speaking with community individuals and groups, folks at the university, here at Hopkins in leadership positions, people in government. And one name came up over and over and over again: Dr. Charles Simmons. Dr. Simmons, much like Congressman Cummings, is a product of Baltimore. He grew up here, went to Morgan State, went to Antioch College, went on and got his Ph.D. at Union Graduate School. And in the early 1970s, he established a center that was part of Antioch College. That was the Homestead Montebello Center. In 1980, that center became Sojourner-Douglas College. Sojourner-Douglas College has provided educational opportunities for thousands of young men and women in Baltimore and in the larger community who otherwise never would have had a college education. Sojourner-Douglas has opened doors, and as we have heard repeatedly this morning, education is the pathway to equity and equality. Education and health are intimately intertwined. And Dr. Charles Simmons has dedicated his life, his passion, his work to achieve equity through education. So, Dr. Simmons, it is for us a tremendous joy to be able to honor you today here at Johns Hopkins University, to recognize your contributions to education, but far more importantly, to recognize your contributions to humanity, to improving the well-being of all of our citizens. In recognition of that, Johns Hopkins University honors Charles Simmons, Ph.D., for a lifetime of work to reduce inequalities. April 23rd, 2013. I will take that down.
Thank you, Dr. Robert Blum. Ladies and gentlemen, let me first express my deep appreciation for the vision and objectives that you have adopted to focus on the underlying factors that are the root cause of health inequalities, and to identify the evidence-based strategies that have been shown to be effective locally and nationally. You've come together to create a learning opportunity to bring together experts and leaders to identify social and neighborhood factors that contribute to the inequities of health, and to share evidence-based strategies that promote health equity, and to create partnerships for research and service that address the social determinants of health, and to identify priorities and to strengthen relationships between Johns Hopkins and community partners to address and reduce the health inequities in Baltimore. As a son of Baltimore, I've been born and raised here, raised in the Edgar Allan Poe projects about 4 blocks west of Lexington Market. So I'm aware of the racism and its relationship to poverty as a primary factor in the social determinants of health. Over the past nearly 75 years that I've lived with these inequities that result from racism and poverty and the extent to which it impacts health disparities. As a community activist and educator, I've devoted most of my life to the empowerment of the community as a vehicle for reducing these inequities. And as Congressman Cummins talked about passion, my life's work has been driven by my passion. Sojourner was founded by local residents to empower the community, to gain control over the forces that impact our lives by developing a college staffed by community residents, many of whom we would educate to address the unfulfilled aspirations of the community. And as founder and president, over the last 40 years, we have attracted hundreds of scholars as students, faculty, administrators, and partners who believe in and have joined in our struggle. And as a result, we have touched and transformed the lives of thousands of families. Our pedagogical model is project-based, providing the opportunity for learning to be linked with action that is designed to improve the quality of life for the student in their respective communities to the benefit of both the student and the community. And so I'm pleased and humbled to accept this recognition on behalf of the students, faculty, staff, and partners of Sojourner-Douglas College. And I wish to express my deep desire to partner with you, Dr. Blum, as you discuss, and I'd like to help design and develop strategies to reverse and impact the inequities in the social determinants of health. And so I thank you. Good afternoon.
We look forward to continuing this discussion in that partnership.
Thank you. Thank you so much.
There's a box down there. I'll carry this down.